ready? Okay. All right, I would like to call the March meeting of the Human Services Committee to order. First order of business is approval of the minutes. Do I have a motion to approve the minutes?
I'll move.
Do I have a second?
Second.
Lisa, legislator Vance, some seconds. All in favor?
Aye.
Next is privilege of the floor. Do we have anyone here to speak to the privilege of the floor? Anyone for privilege of the floor? Okay, seeing none, we will go to our first proposed resolution, which is to amend the 2024 budget for year-end reconciliations, Department of Mental Hygiene and Social Services.
Hi, Diana Songer, Deputy Director of Finance for Human Services. The resolution is to amend the 24 budget for year-end reconciliations for the Department of Social Services. Some expenditures have exceeded the budgets while others have a surplus. We are requesting an increased use of fund balance of $175,000, $175,012, and to make the following changes to the 2024 budget. Increase appropriation accounts totaling $4,205,451. Decrease appropriation accounts totaling $812,510. And increase revenue accounts totaling $3,217,929. The increases in appropriation accounts are due to increase in cases, resulting in increased expenses, which are offset by the corresponding revenues. Some other reasons for the higher appropriations include software expenses were budgeted to equipment that were paid through the contracts. Accounting and related services expenses increased due to a rate increase and an increase in the number of applications. Emergency housing costs were higher due to an increase in homeless cases, which went from 118 in December of 23 to 188 in December of 24. Child care eligibility changes in October of 2023 resulted in more families qualifying for the program. Child care assistant cases increased by 182 between October of 23 and February of 25. Family assistance cases have increased from 734 in 2023 to 763 in 24, and they continue to trend higher. And the foster care rates increased because the counties were all mandated to pay foster parents the maximum state aid rate, which resulted in 2 increments of increases. In April of 23, the increase averaged a 22% increase, and in July of 24, the increase averaged 18% increase. As these numbers demonstrate, case numbers have increased in many areas, causing appropriations to exceed their budgeted amounts. We were able to offset most of the increases with the additional revenues in the appropriations that have a surplus.
Okay, any questions, comments, concerns? Legislator Vance.
Is there any insight at this time about the homeless numbers possibly decreasing at all in the near future?
From what I've heard, no, it's not a good situation with that. I know they are trying to find, John has been trying to find other ways to try to mitigate that problem, but right now I don't think there's a plan in place to help at this point.
Thank you.
Anything else? So many of these increases in appropriation accounts were just unforeseen.
Yes.
We didn't want to budget for it.
Yeah, it's
'cause-
difficult. They're mandated
Right.
services, and we do the best we can to, guesstimate what the numbers are going to come in at, but it's just really
It's the
difficult.
same conversation we've had with safety net and
Right.
some other topics where we've needed extra money and probably will again.
Unfortunately,
Well,
yes.
Could you just go through the foster care again? That they mandated us to pay the
Yeah.
maximum?
Right,
Did they
so
increase that?
Previously, many counties, including Chautauqua, were paying less than the maximum state aid rate. And there was a ruling by the state that all the counties were mandated to pay the maximum amount. So rather than impact the counties fully at one time, they said, okay, we're going to increase it a little bit. In April of 23, they raised it 22%, and then again in July of 24, they raised it 18%. So that brought them up to the maximum rate that they're required to pay.
But we weren't required to pay it before.
No, I don't
It
really
seems odd.
understand or know
Yeah.
the backstory with that, but that's my understanding, yeah.
Okay. And the family assistance, can you maybe elaborate on that a little bit more? Maybe I was trying to keep up with a lot of
Yeah, the
information.
cases are going, just across the board, all the cases are increasing, so along with the case increase, the expenses increase.
Yeah, okay.
A lot of that has to do with the hotel, homelessness has a big part in that.
Right, right. Okay. Anything else? All in favor?
Aye.
Thank you.
It brings us to resolution number 2, which is to authorize acceptance of New York State OASIS 2025 funds for substance use disorder prevention and treatment.
Hello, Trish McLennan, Deputy Director with Department of Mental Hygiene and Social Services.
Before you start,
Absolutely.
can I ask you one question?
What is, yeah,
I'm starting to hate acronyms.
I don't blame you.
For people the millions of people who are viewing on Facebook, could you just explain what
Absolutely.
OASIS is?
Absolutely.
The long version.
You got it. OASIS stands for the Office of Addiction Services and Supports.
Okay, thank you.
Okay. And that is the regulatory agency that certifies any licensed inpatient, outpatient, and residential services within New York State.
I'm going to ask that of
Okay.
everybody, because,
I'm glad,
It's
I'm
just-
glad. We did put it on the resolution, we did spell it out on there. but
Well, yeah,
You're
I
right,
know,
it's
but
not
I
on the
just-
agenda like that. You're absolutely correct.
okay.
So what this is, we are not requesting a change in our budget because this was already planned and is in our budget for 2025. We did realize we did need to come with a resolution. Part of it is we did realize we needed to update a contract we have with OASIS. It's been a standing contract because these are flow-through funding that we get every year. So there's a contract that's good for up to 10 years. What we realized, though, is that a few years ago, a couple other agencies were added to it, and we needed to update it. So that's the other thing that's going through, but to do that, we needed to come with a resolution. So this money comes through our county, and each county does this. OASIS gives money to each county LGU, local governmental unit, which in our case is Departmental Hygiene under Carmelo's leadership. And depending on what they are requesting it be used for is which agencies we give it to. So this money, in this case, it's $1,665,239 this year. That is used for 2 primary agencies in our county. One of them is UPMC Chautauqua's Substance Use Disorder Residential Program. So their long-term program, as people will say it, which can be anywhere from 60 days to up to a year, could be even more. There's not a time frame on that, but they just need to meet certain criteria. So that is one service that provides. It's not a service that is sustainable on its own. So the state gives money to us to give to them so they can sustain that program. The other one is for Prevention Works. Prevention Works is an organization within Chautauqua County. It's the only licensed organization for prevention of substance use disorders, solely for prevention. And so some of this money was also provided to them to be used only for prevention services. So we do contracts with these agencies, we review them, we ensure that they are, we pay them quarterly, we make sure they have backup for it, then we submit a fiscal review to the state each year. So all of this is well accounted for, but that's what this is. Office of Mental Health does the same thing with 10 other agencies, but for OASIS, we need to have a resolution for that. That's
Okay.
it.
Any questions, concerns, comments?
I wholeheartedly support the good work of Prevention Works. I've toured it and been there several times recently.
Good.
And last year they had a celebratory anniversary at the Harbor Hotel, and the Prevention Works program was outstanding, just outstanding.
They're
It
amazing.
really spelled out how much easier it is to not get a bad habit than to try to kick a bad habit. So
Yeah,
thank
yeah.
you.
No, there are many of our schools, and they do, our Tapestry grant also supports them with a lot. We've used some money from opiate settlement funds for them too. So yes, we agree. And their new site in Faulkner is incredible. We were out there last week to visit them. So yes.
Okay. Anything else? I just have, 1,665,000, is this more or less consistent with past?
Yeah, I think it's up about 40,000. So they're,
Okay.
Oasis
Somewhat.
is making sure it covers as costs increase.
Yeah, okay.
So yes,
So my concern is it's not decreasing.
no,
but
it's
it
not
is
decreasing.
so-
It definitely increased.
All right. Anything else? All in favor?
Aye.
Aye. Thank you, Trish.
Thank you very much.
This brings us to proposed resolution number 3, authorizing standardization of Viken, if I'm pronouncing that correctly?
Yes.
I am? Wow. Detection PB 200E XRF lead paint analyzer. Is there something for XRF?
X-ray fluorescence.
X-ray fluorescence, okay.
Yes.
Sure. So Jessica Worsley, Chautauqua County Environmental Health Director.
Anna Powell, Childhood Lead Program Coordinator.
So this resolution is meant to help us standardize the equipment that we're using with the various lead programs that we have. We currently use this Viken brand lead paint analyzer, and we are looking to purchase 5 additional units. And so, you know, with the lead rental registry program gearing up and our ongoing HUD lead hazard reduction programs, grants that we have, we're just looking to standardize the equipment so that we're using the same equipment throughout all of those different programs. We need to put this through for a resolution in consideration of the fact that there is another brand of device that does similar achieve similar results, but our staff is already familiar with the Viken, and we've had great success with it. They're nice and hardy and durable, so we don't have to replace them frequently. So, you know, this resolution is meant to just allow us to continue utilizing that brand.
Okay, any comments, questions? I've got one or two.
Sure.
So we have like in these lead paint analyzers right now.
Correct.
And how many do we have now?
3.
3. So we would, and 5 more makes 8.
We're adding more inspectors.
Yeah, right.
Yeah.
I mean, yeah. I just curious as how many we had.
Sure.
Oh boy, that one escapes me.
Are the inspectors in this 25 budget?
Yes.
Yes.
How many you plan on hiring?
4.
So we've just hired 3 public health technicians. They're gonna start later this month, and we're waiting for the other positions to get through the HR process.
I remember. Do these require parts, fixing, repair? Do we have inventory of?
So because they are a radioactive device, they do require resourcing every about 18 months. But we add that into our budget to make sure that's paid for out of grant funds.
Resourcing
Yep,
is,
so it's a radioactive device that actually allows it to read the lead-based paint back
Okay.
for us in real time. We don't have to wait for results, and it's non-invasive to the homes either.
and
But
to the
we have,
people using it?
what's that?
And to the people using
Correct.
it?
Yeah, so wow, we could have a conversation.
No.
Okay, so when you used to use a radioactive device, you used to have to wear like dosimetry badges to make sure that you weren't being exposed to anything radioactive.
Okay.
These products have shown throughout many, many years of little to no exposure to the user. So that's what the E is on the end, is exempt. So now we don't have to perform leak testing on them anymore, and we don't have to wear dosimetry badges because they don't pose a hazard. So they have enough data throughout the years that they have run as a business that it doesn't pose harm to anybody using them.
So, but they don't need, and where I'm getting at is, like, we continue to use Viken, and we have like a supply of
Yes.
repair parts or something, we don't have to stock another
Yeah, so,
brand.
no, other than getting the resourcing to make sure that it has enough of the, you know, the
juice.
radioactivity necessary to do the job, no, we haven't had any problems with these, and that's that's why we are,
Right.
you know, putting this forward, because we know this brand, it's worked well for us, it's nice and durable.
Yeah,
And-
the only thing outside of the resourcing that we've had to do for maintenance is like maybe a battery door lost its little tab or something, but we send it back to them and they probably make a new one with a little 3D printer and put it on there. And the only other thing was one of the like software interfaces needed to be replaced. But I mean, I think we've had these since 2016, and that was the first time anything had ever went wrong with them
And
outside of resourcing.
and the purchase that we're planning does include a warranty as well on the devices. 5 years?
5 years.
Yeah, 5-year
Yep.
warranty on the devices.
Does that compare with the other brand? or
Yes.
Is the other brand significantly cheaper?
No.
No,
Okay,
it's actually a little more expensive.
okay.
Which one of these units cost here?
Oh, I think the total price for all 5 units is 108,000. So
20,000.
they're about 20,000 a piece with that 5-year warranty, and that also includes the first resourcing.
And that's got to be done, what, every 18?
18
roughly
months. Yep.
Anything else?
Sounds like a cool piece of equipment.
I'd like to see it work.
Like a laser gun.
I could, not a laser gun. And it is radioactive, so we do use safety first, Marty. You can't just point it around.
Sounds like something out of a Star Wars movie. but-
I mean, it is very much, I mean, yeah, it's a handheld device. You hold it up to the surface, you click the trigger, you wait for it to read, and then the device captures all of that data. You bring the device back, hook it up to a computer, download the data.
Creates a report in
Yeah.
about 2 seconds.
And that report you can show to the,
Yeah,
owners
that's the
and
report that
that's
we
the
give
whole-
out to all of the property owners.
it's like, hey,
So,
hey, you do something.
You don't know whether the report, you get to the report part that the page got lead, or would you know?
no,
the
we
minute
can
you-
see it, we can see,
Okay.
it comes up, it has kind of like a little mini screen, touch screen, where you can select different components and things like that, and as soon as you enter the component you're shooting, then you pull the trigger and it comes up immediately.
Bingo.
Yes.
Yeah, all right.
Yep. So if you guys ever do want a
Display.
yeah,
Demonstration.
demonstration, that's what the word, I'd be more than happy to bring one in.
Hopefully, we don't find any lead in the county buildings.
Can you do these desks? They're pretty old.
So we found some on vinyl chairs in our office, actually.
Yeah.
Really?
Yeah, yeah.
We got a few old things kicking around these offices, so, you know.
Maybe we better not have demonstrations. All right, anything else?
No.
All in favor?
Aye.
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 Thank you, folks.
Thank you. Okay, I'm sorry. Next up, we have a presentation from Public Health Substance Use Prevention Programming Updates, presented by Steve Kilburn,
I don't recognize
Substance Abuse and Addiction Services Coordinator, and Lacey Wilson, Public Health Director.
You guys
Sorry, I
set up
butchered all
That's all right. I was gonna say, you can't take our team anywhere.
I almost
Yeah,
didn't
we'll-
even
we'll-
remember to do it. I'm signing this stuff.
We'll diagnose epidemics and have, lead exposure, figured out for us. So yeah, you can't really bring us out.
I'm thinking of this chair I'm sitting on. Please
So
identify
thank you.
yourself.
Yeah, so I'm Lacey Wilson, Public Health Director for the local health department.
Steve Kilburn, contractor at the Health Department.
And before we get started, or to kind of get us into the presentation here as Steve and Justin work on this, of course, first, just a thank you for inviting us back and asking for us to come and give you an update on the successes that we're experiencing as a county, something that we're always very happy to come and talk with you about. And just kind of a timely night that I really enjoy the experience that we have to bring people from the department to speak on behalf of the great work that the department is doing. I think it just speaks to the really depth of knowledge and expertise in the department. And, you know, on the heels of you getting to talk with Anna and Jessica, there's just a lot of good things happening. So we're very happy to be here to talk about that. Also timely that Trish was here to talk about, you know, all of the work that they're doing around substance use. And I think it's really be highlighted by what Steve is going to present tonight, that really our role in the mix. I think, you know, the mental health aspect of it is very clear to people, and they have such important work that they're doing in the realm. It's very visible. The public health work on the side of the prevention side can sometimes be a little more in the shadows of things. Sometimes it can be a little more difficult to see what we're doing in that aspect. So again, we do appreciate the opportunity to talk with you about that today. Steve's going to give many more of the details, but just kind of the high-level overview to just give you a context of where we come from and what we're tasked with by state DOH on our prevention side of substance use, and what Steve is really kind of spearheading from our department. So DOH really sets a primary priority area around the prevention of substance use. So to Legislator Vanstrom's point earlier, it is the old adage, an ounce of prevention, you know, is worth so much more. So they really task us with facilitating and coordinating the systems and environmental approaches to not only just opioid, you know, prevention, but substance use prevention across the board. So much more in line with advocacy around policy, the development of policy, legislation, coordinating efforts and training with you know, the multi-sector partners that are out there in regards to EMS, law enforcement. This is very much so where Dr. Falk is very visible and just doing a really wonderful job in bringing those other sectors kind of into the fold of prevention, where typically they're on the front lines of more mitigation and diversion. So there's a lot of training there that happens, also education and outreach to the community. And really where it all started, if you can imagine this, really our task as a health department from state DOH started more formally around opioids in about 2006. That's when state legislation was passed to make naloxone, what people mostly know as the brand name Narcan, available to be administered by non-medical professionals. So you can look back now, we're coming up on 20 years. What does that initial step look like now operationalized in our communities? And what that really looks like from the prevention side of things is, you can imagine, you know, to just make a product available in a community doesn't solve a problem. How does that product get to the people who need it? How are those people trained to how to use it properly? Where do you get that? How do you source that? That is just one specific kind of microcosm of the work that Steve has really done in combination with our partners in mental hygiene, prevention works, the whole CSARP community of providers. So we're very proud to have Steve with us, and I do have to also, you know, tout a little bit that the work that he's done for the county has been recognized statewide and nationally as well. He was just recently presenting in New York City on the great work that's happened here in our county. At the state level, Dr. Holtgrove, who is really spearheading the efforts on the DOH side around substance use prevention and overdose reduction, has recognized the efforts here as well. So kudos to the community members, to you as a legislator who have been very supportive of these efforts as well. We thank you for your continued support. So with that, I'm going to turn it over to Steve.
Yeah, I too thank you for the opportunity to be back. I think it was August. I kind of went over some of our strategic plan, and my goal in the next very few minutes, less than I'll need, is to give an update, obviously, to kind of take us on a bit of a view of how we think about addiction and our response to it from a public health point of view, and then highlight what have been and are ongoing progress as well as continuing challenges. So that's the short version. Let me dig in here to some of the details. So again, my hope is that we can think about the work that's being done here in the county from what we'll call a public health approach, well, which is a public health approach, but specifically for addiction and substance misuse. It is, as maybe some of you have noticed in social media and maybe in the newspaper, it is the 100th anniversary this year of our county's health department. And so it seems particularly timely to just take a couple of minutes, or even less, to just say, what is a public health approach? How does that seem distinct from, I don't know, another approach? Well, perhaps obviously we're talking about public health, so we're talking about the health of entire populations. Thinking in terms of everything from a neighborhood, to county level, to nations and beyond. And so in our case, we're looking to take a very comprehensive and county-wide and systems approach to degrees to which, perhaps until we're in the system and it's not working, we don't realize how dependent we are on systems functioning in order to accomplish, in this case, good health outcomes. As we've been hearing, a public health approach has a priority on prevention. But a word about that. There are recognized different levels of prevention, so we can think about primary prevention. This is where we typically think about prevention as avoiding the problem in the first place, whether in the case of addiction, substance use, experimentation, or what have you, or in other diseases as well, that we're intending to try to create environments where we don't have to address them at all because they're prevented. But that's not the only form of prevention. Secondary prevention is seeking to screen and get early intervention for folks who have the beginnings of some condition. So early detection and intervention. We all know different medical ways in which our doctors have us do those sort of things. And then finally, tertiary prevention is preventing the recognized disease or condition from continuing and getting worse. So it's acknowledging that the presence of that condition is there, but trying to treat it and to keep it from becoming worse or potentially even fatal. So that's how we want to think about our approach to addiction from a public health point of view. Next, we are absolutely committed to evaluation, or more bluntly, getting results. It is insufficient on behalf of those many people in our county who are afflicted with various forms of addiction, etc., to not be pursuing at all times the best possible services for them and know that we're providing the best that we can do. And then sort of finally, just to say and make a little pitch, as has been alluded to already, public health is kind of an invisible presence unless things really run off the rails. But in ways that you and I probably rarely even think about, public health is at work. We're at the 100th anniversary of the health department. Today, you and I, unless we maybe work in healthcare and have a TB time test, we almost never think about TB. Tuberculosis. 100 years ago, when the rates of tuberculosis were over 400 times what they are today, people were thinking about tuberculosis a lot. And the 100 years, actually, it's been probably some ups and downs along that route, but the progress that has been made in those years is, frankly, a public health win. And it's one, though, that we can't let our feet off the pedal because tuberculosis is still, and I'm using it just as an example. I don't address tuberculosis in my lane, but public health is a huge driver of saving lives, improving the quality of lives, strengthening our communities. It is really an absolute foundation for all of the other things that we want to do as a county and as neighborhoods towns and cities, and even in our families. And then finally, the economic impact of good public health is frankly immeasurable. And again, it's until we see the problems arise and their economic implications that we don't really realize the degree to which good preventative public health is an economic it strengthens our economy here. So now, having done that, let me dig into some of particulars. Let me visit one of the sort of most tragic elements of the overdose crisis, probably the most tragic element of it, and give us a bit of an update on where we stand now that we're beyond 2024 and into 2025. This is a graph that indicates the number of overdose fatalities annually since 2015, and you can kind of sense the trend that we had sadly been on, namely a trend largely upwards. When I was here, I think in August, I spoke about our strategic plan and ambitiously setting goals of reducing the number of fatal overdoses in our county by 33% over the next 2 years, which would have been now at the end of 2025. And that in the face, as you can see, of generally rising numbers of overdoses. So again, we have a strategic plan that laid that out months ago. Well, I'm happy to be here to be able to say to you that what's actually happened is that in 2024 alone, we've seen a 51% decrease in overdose fatalities. It is really a remarkable observation. This is fatal overdoses, the leading, or was, thankfully I can now say that, past tense, the leading cause of death of our county residents under the age of 60. In 1 year, it's cut over half. You will read, and maybe you have already, other communities, even at the state and national level, where overdose fatalities are declining, and that's always, of course, good news. Rarely will you see a number like 51%.
The high average is about 30% in other communities.
And just very, very early in the year already, but the decline has pronouncedly continued into 2025.
Can I ask a question?
Please.
How much of that do you think is due to the use of Narcan?
Yeah, well, the obvious question out of this is, well, what's happening? Of course, I don't know, the particulars because this addiction is always very complex. But we absolutely have to attribute a significant amount to the distribution of Narcan. Now, Narcan has been distributed, as we heard, for a long time. But as I would typify it, I think those sustained efforts at both distributing it and educating the public about it has kind of brought us to a tipping point where more often than not now, when I talk to somebody at maybe a public event, they're already familiar with Narcan.
Can I just add really
Please.
quick, Steve? So, wonderful question in that it highlights exactly that the necessity of the systems approach to it. Because we know that Narcan has been publicly available since 2006, we've not seen a reduction for 20 years. So what does that mean? It's been the planning, the coordination, the development, the access, the education. All of that takes so much time. But when you pull those purse strings together, you see these reductions happen. We are seeing them, again, this is an educated anecdotal assessment here. What we're seeing in our county is the underpinnings of the coordination of a county that's large enough to put some resources behind these endeavors, assign a person full-time to really handle that coordination, but small enough to bring the necessary stakeholders to the table to get it done. With that said, I don't want it to come off as, it's just the Narcan, did it, because there is so much of that coordination. And the other downstream improvements that occur because of that, the CSARP group, the other behavioral health groups that are meeting around this issue, there are so many other topics that end up coming to the table, better communication, more partnership, better collaboration, that improves all of the other aspects around substance use issues as well. Collaborations between law enforcement, UPMC, hospital networks, the Westfields, the Brooks. So it only strengthens. Sometimes it takes that one, kind of catalyst to get it moving.
Just to drop one more statistic, because it's stunning, I think, about overdose fatalities. There was a 91% reduction in the Dunkirk zip code. What that means is there was one overdose fatality in that entire 14048 zip code in 2024. So this has been really a turning point year, and while we're vigilant to know that there are other drugs and other potentials for problems down the road, we're wanting to build on this momentum. To that point, let me move quickly to another point about, as we've been hearing about already, prevention services and getting into the schools. Epidemics don't end by just sort of treating your way out of them. They end when we can find ways to prevent them. And we've already heard about that work, and we've heard about the great work that our partner at Prevention Works is doing. I just wanted to highlight, excuse me, Trish made allusion to this earlier, but to give some specifics, that here in the Dunkirk, there we go. In the Dunkirk school district, opioid settlement funds have been able to be employed for Prevention Works to expand their offerings in that region. But they're in, I don't have the number off the top of my head, but they're in multiple others of our 18 school districts. So we're really pleased to be able to continue to support them in various ways.
It's primarily education.
It is, but it's not your sort of, and I don't mean to disparage the DARE program, because I think whatever the pluses and minuses, and every time somebody says that didn't work, somebody stands up and says that's what kept me from using. So, but there was a kind of prevention education that was sort of the shock and awe, this is what happens if you use drugs, this is your brain on drugs, et cetera, et cetera. Now it's very much different, not that there's no education about drug use, but it's very much the social emotional skills. The things that prompt a kid to want to start changing the way they feel and finding better ways to do that.
So the counseling?
I mean, there is counseling available.
Yeah.
Department of Mental Hygiene has counselors as well as school districts. But no, this is in classroom settings, but it's developing the skills of how to manage one's emotions just sort of, not naturally, but non-medicinally. Yeah.
Conversational skills, literally giving dialogue and practicing dialogue, role play. These are also to be noted. I think back in the early days, even before DARE, a number of the programs that we do in kind of the social realm of health weren't necessarily historically what we now refer to as evidence-based. Mm-hmm. So these are all evidence-based programs. Tricia alluded to their program, that this is a really credentialed and vetted organization. So really what they're doing is they're looking for models that have worked and have evidence and data backing that show that there is success historically. And they will take those, specifically ones that they know will fit in a community like ours too. There are a number of evidence-based programs out there. Mm-hmm. Many of them might be for urban settings or very specific population groups. So Prevention Works is really, that's kind of their expertise in seeking out these programs that work best for.
So I said earlier that the public health approach is very committed to evaluation and results, and I don't have sort of a particular metric, because this, in fact, maybe this very month, under Prevention Works auspices, an every other year survey of local students is going to be undertaken, and so those results are really, really helpful. To get some snapshot of what's going on in the school districts, and then, of course, to set some goals about how we can reduce the levels that we discover from that survey. Quickly, to just recognize, again, that when we talk about addiction, we're obviously, there's so few things, really, that aren't impacted by it. The reduction in overdose fatalities will not be we will continue, will not be ignored, and we will continue to keep the attention on that. But it does give us, I think, some space to be able to think about other things, like the most deadly addiction in the country. far exceeding the death rate due to opioids, although it's a slower death. And of course, perhaps obviously, I'm talking about the addiction to tobacco. And the implications of that for our own county, both from a public health and with all of the implications, as I said earlier, is huge. Of course, it's no secret now that tobacco use shortens life expectancy. I heard just today about a campaign that was, I think, in Britain, where they, using good evidence, said every cigarette about 20 minutes off your life. And in the process, just aging you up that much faster. About 18%, it varies year by year in surveys, but that's roughly what the consistent surveys are indicating of our county residents smoke cigarettes. But what, for the sake of really our efforts right now, what we want to acknowledge is that there are very unique dangers to tobacco and other products like it to our young people. And that's where the focus really we need to be, and not miss the fact that, again, continued nicotine dependence has huge public health implications. We want to get upstream. So relative to that, what are the unique dangers here for youth? Well, again, no time here to cover all of them, but they really do, in early onset of any addictive substance, raises the likelihood of a lifetime of addiction considerably, as well as other impacts on their developing brains. Today, and this is the real pain point in our school systems, are the vapes. They are apparently hugely popular. And of course, now we live and have for a couple of years in a world where marijuana is present. So if I could just highlight why this is really so important, it's perhaps surprisingly unsettling that 10, 11% of high school seniors in previous surveys reported some history of tobacco use. Maybe that doesn't seem so unique, but almost a third, so like 3 times as many, reported some history of vaping. Vaping is the new cigarette smoking. And about 25% of them said that they had vaped marijuana. This is high school seniors reporting this. That bodes poorly. We'll look forward and hope that the next survey indicates that some progress has been made. But we need to get upstream, far upstream on this, and to just give us a sense of what that looks like. You have to forgive the layout of the fonts have changed. Obviously, our goals are to reduce youth tobacco use and vaping. Nobody's going to win if that trend isn't addressed. How do we do that? Well, a couple of things. We have working with partners like Prevention Works as well as Tobacco Free CCA. We have a kind of county-wide school-based package, if you will, that we work with them to try to really give a standardized menu to each school district that they can use, evidence-based, in their schools to reduce this use. And we want to, as a public health department, increase the enforcement of the illegal sale of tobacco and vapes. There are 113 licensed tobacco shops in Chautauqua County. 14 of them were, Jessica can correct me if I misrepresent this, 14 of them were, if you will, tested with potential underage sale. 14 of them failed. So of the licensed tobacco shops in the county, over like 12% of them were already, this was last year alone, found to be engaged in the underage sale of tobacco. And that doesn't even count the ones that weren't tested. Weren't monitored, right. We've also found vape sales to minors, and et cetera. So happily, we're not the only department of county government that's concerned about this. Ours is from a public health point of view, but the district attorney, his department is also very concerned about this, and we will build some greater partnerships to be able to, the licensed shops that are following the rules don't deserve to have to compete against those that don't. And again, when they're selling to underage buyers, then nobody should be settled with that.
And they also sell illegal products, too.
And they sell illegal products as well. There are, I think, 34 vapes products that are approved by the FDA. All the others are illegal.
And in addition to that, we won't speak to this because it's clearly not our lane, but where, from our initial kind of planning with the district attorney's staff, they also have particular concern in just untaxed
Tax.
sales.
Yeah, yeah.
As
Yeah, that's really where they're
there's
coming
a
from.
major economic drain component to this as well.
Let me really move quickly here because I keep saying that and then I go on. But we can't talk about the harms subsequent to addiction, especially IV drug use, without recognizing the severe problem with hepatitis, and specifically hepatitis C, a bloodborne disease, a blood-transmitted disease, IV drug use, of course, being a prominent way in which it is transmitted. A lot of people who have hepatitis C are asymptomatic, have no idea that they have it, and of course aren't inclined to seek out any kind of treatment, but they're not symptomatic yet. And typically when the symptoms, as I understand it, do begin to emerge, the disease is fairly well advanced. And left untreated, of course, it can lead to very severe problems. But treatment is extremely effective now. But of course, it has to be started early. Starting it early also has the benefit of reducing the transmission of hepatitis. Our county, and this is sort of good news, bad news, our county, on the one hand, is showing some improvement in the rates. These are New York State published case rates per 100,000 of the population. The top line, blue, is Chautauqua County. The bad news is we're still much higher. In fact, we're the second highest county in New York State for the case rates of hepatitis C. So a renewed focus on addressing hepatitis C in our county is very much consistent with addressing addiction because it is one of the principal drivers of it. And the first step is this data goes to 2023. Sometimes that's considered pretty up to date, but we need some more mechanisms by which we can measure what's going on. That's the first step, and then we can work on how we reduce it. And finally, a much sweeter photo, but a very serious topic to end on, and that is a final area that we want to bring this public health approach to is addressing the needs of really some of the most tragic victims of addiction and the epidemic. And that, of course, as you can see, are the newborns who are born having been exposed to mom's substance use. These are, again, graphs that demonstrate our county's rates. We're coming down, we're above the state. But even more than what you see here, the diagnosis of NAS, neonatal abstinence syndrome, doesn't capture the whole population of children who have been impacted. But if there's one place where prevention and getting upstream will make a difference, it is here. The amount of costs in the education system, in the healthcare system, and frankly, in the legal system subsequent to unaddressed developmental disorders due to substance exposure at an early age makes every investment a huge return on that investment. So we have some work underway where we would set up some projects working with local partners to serve not only the children, but also to bring their families into services. So I kept saying I would be quick, and I guess that's all relative. But,
And as Steve wraps up, I think too, the items that he highlighted where, again, we see that there's just such opportunity to build on the strengths of the models that have been created around the work around substance use and opioid use. So all of these things that have been presented today, we have the capacity to do some very substantial work to really mitigate and, again, get more upstream and prevent some of these issues. So there is a very hopeful
Yes.
note to all of this as well.
Yeah, I hope and frankly expect the next time I'm here to give you an update that I will have more good news.
I just have one question. All of the school
Yes.
work, the programs and stuff, how many of our school districts participate? 50%?
It's over that. In fact, the shortest answer is 100%. Not that prevention works is in 100% of the school districts. Every school district, as we know, is going to make their own decisions. But BOCES does provide another curriculum of their own. Oddly, health education is kind of required, but not really very well overseen. So they're not even sure if the schools are using the curriculum that they've provided them, but every single school in the county has access to evidence-based prevention material.
They have access, but do they use it?
That's the point. Now, if Prevention Works is in there, we know absolutely. I think I'm right in saying they're in 11 of the school districts of the 18.
18?
Yeah.
Well,
And so
that's-
we're
that's
looking
good.
forward, one of our goals is to see that expand. It's not their unwillingness. I mean, obviously, there are constraints about staffing, et cetera, but every school district kind of has their own
And I
priorities.
guess how can we get into those?
When the next time I'm back, I hope to be able to tell you that they've been able to get into those as well.
Is there any other questions?
Thank you.
Thank you
Thank
very much. Okay, is there any other business? All right, I will entertain a motion to adjourn.
So be.
Okay? All in favor?
Aye.
Thank you.